Embarrassed. Too embarrassed to speak to a loved one. Too embarrassed to speak to your doctor.
Too embarrassed. When in our lifetime, 1 in 4 black men will be diagnosed with prostate cancer. 1 in 12 black men will die from prostate cancer.
Let me repeat that. 1 in 4 black men will be diagnosed with prostate cancer. 1 in 12 black men will die from prostate cancer disease.
1 in 12. That could be your dad, even your older brother, uncle, or grandfather.
You need to make sure they are not embarrassed to speak to you or their doctor about it.
Hey, Dad, have you had your prostate checked out? See? How hard is that? It's easy. Just start the conversation.
Prostate cancer is survivable if caught and treated early enough.
Don't let embarrassment stop you having this important conversation.
You may save someone's life.
Not just your own.
I suppose I could start by just explaining to the viewers and listeners what the prostate is, because there's a lot of confusion about that. So the prostate gland is a sexual organ. If you think about your bladder, where you urinate from, at the bone just here, at the lower part, and the water pipe coming through the penis, the prostate gland sits between those structures. And it's normally the size of a walnut, and it's a sexual organ. So what it does, it adds liquid to sperms for fertilization to have babies. As men get older, that prostate gland can swell up. And imagine your prostate being like a donut.
Yeah.
The donut becomes swollen, the inside channel becomes tighter, and then you can't urinate properly. So imagine your bladder's a pump and the prostate gland's a tap. If the tap starts to become tighter, the pump is working really hard to get the urine out, and that can manifest in problems with urination that men have as well. So the two are combined.
Why I came up with this topic is that an uncle of mine died of it, and he was a doctor as well, you know. And, you know, in fact, you know, like, I think March last year, I was still talking to him, and he was saying, oh yeah, you gotta take care of it yourself, you have to do this, you have to do that, you know, this. And August, gone. So now I'm experiencing, you know, guys that are going through the same challenges like that, you know, and I'm saying to them, like, have you tried to consult or whatever, you know, or maybe it might be part of your genetics or thing like that. But we don't talk about that most especially in our community, in the barbershop. We only talk about things that, you know, men, you know, maybe like sexual,
football, sports.
And things like that. So I'm really keen about this. Yes, you talk about, you know, how it is, but basically, can you physically diagnose yourself?
It's a difficult one, and that's a difficult challenge, because in prostate cancer specifically, in the early stages, when your blood test called PSA, so that's the blood test needed, you go to your GP, and prostate specific antigen is a blood test that you do to diagnose, one of the blood tests we do for the diagnosis of cancer. In the early stages of prostate cancer, you have no symptoms. You're well, you're fine, you're fit, there's no issue. As the PSA or the blood test becomes higher and your prostate may swell, it then may cause some symptoms such as blood in the urine, problems urinating, waking up 3-4 times a night to pass urine, not being able to flow properly, the flow being very poor. Some men have sexual problems where the erections aren't as good anymore. So these are the symptoms that may relate you to go and see a GP or your doctor. And I've seen men where the only symptom they have is back pain in their back, which is a very bad sign, because that tells me that the prostate cancer has already spread to the spine. So we had a young guy a few weeks ago in his 50s. His first presentation was a bit of back discomfort. Went to his GP, PSA was done, PSA 1,000. If I tell you a normal PSA is between 0 and 3. So PSA of 1,000 is already very high. And he was diagnosed with prostate cancer that's already spread, and he's been told there's nothing they can do about it. So they can give drugs to suppress, but there's no cure. So the thing about prostate cancer is when you're well, in the early stages, you have no symptoms. And some men just get picked up on an incidental blood test and their PSA is high, and then they go for the treatment.
What are the symptoms?
In a lot of men in the early stages, there are no symptoms. So we advocate, especially for black men, I say if you're over the age of 40 and you're black, start getting your blood tests from your GP every year to 2 years.
Every year?
Between every 1 and 2 years. Go to your GP and ask them for a PSA, prostate blood test. And do not let them say no, they cannot refuse you. At the moment, the NHS doesn't advocate screening. So screening means when you looking for disease when people don't necessarily have symptoms. But we know black men are 5 times more likely to get prostate cancer than white men. So the guidance at the moment for the UK is no one should be screened. You should just talk to your doctor and get a blood test. But if you don't know, you won't know to ask. Number one.
Why is it?
Number two, some people don't go and see their doctor, so they'll never go and see their doctor. They'll never know. And this is the problem. So I'm a big advocate of black men, but all men, but mainly black men over the age of 40. I turned 40 recently.
Yeah.
I had my PSA done. Every year I'll get a PSA done. So at least I know what my blood test level is. Yeah. If you don't know, you don't ask. If you don't ask, you never know.
Yeah, but why is it that the NHS doesn't?
Because like for women there's breast cancer screening. So when women hit a certain age, they get a letter saying come and get a breast cancer check. The problem with PSA is a bit more controversial because if we screen we have to screen many men to pick up cancer. So it's not a good use of NHS resource. However, there's nuance to it. And I say for black men where our risk is higher, I think that we should be go into our GPs, our doctors, and ask him for that blood test every 1 to 2 years. Because at the end of the day, GPs are busy with COVID now, getting appointments is difficult. Yeah. You may not always, the GP, all the will in the world, may not always be thinking about it. And you are your only health advocate, or your best health advocate. And you need to be empowered to know these things, basically.
So why is it that ethnic or black people are majority always affected?
Yeah, so mostly. we don't know why, but if I go to the top 4 places or top 10 places where there's prostate cancer in the world, they're all black countries or where Africans have originated. So we're talking about Nigeria, we're talking about Ghana, we're talking about Jamaica. So I was in a conference 2 years ago, and they've got very, very high rates of black men dying of advanced prostate cancer in the Caribbean. Again, because people are not knowing about what PSA is, they're not going to their GP, and these guys are presenting with advanced cancer where it's already spread. And if you get cancer that's early, it can be cured and treated and move on with your life.
Yeah.
If you wait till it's already spread, there's no cure. We can give drugs and chemotherapy to suppress things, but eventually it will kill you. And I'm seeing like this week, I saw every day this week a black man coming in with advanced prostate cancer diagnosed in South London. So this is a big killer. Men don't understand, and often as black men or men generally don't go to the GP until things are hanging off, dropping off, or our partner or wife is nagging us to go. Yeah. But we need to be proactive. Women, they feel a lump, they feel something, they'll go and get their checked out. Because men, we'll leave it till it's bleeding, dropping off, pain, then we go and get checked. And that's a false mindset, and that's why it's killing black people, killing men.
Because breast cancer, you could either feel it. I know prostate, You
can't put your finger in your bum yourself.
Yeah,
you can't feel it, but it's about encouraging men to get that PSA blood test. If you don't get the blood test, you don't know. And a lot of men are scared about the consequence. You do a blood test and you put the finger in the back passage to feel the prostate.
Yeah.
And they go, that's
and
gay.
You get more
they get stressed about it.
More things to worry about.
Yeah. But as I said, I've seen every day this week. We've diagnosed advanced cancer in young guys every day this week. And all of them, I'm sure if you told them a year ago, get a blood test, to avoid this, they'd have all gone for it basically. But it's knowledge. They didn't have the knowledge. They didn't know. They felt well in themselves. There's no problem, So,
guys,
really get your PSA checked. Yeah.
Yes.
Especially if you're black. Yeah. And especially if you've got family history. So I'll give you my personal story. My dad had prostate cancer. I'm Nigerian background. My dad had prostate cancer at the age around in his 50s. Yeah. So my risk is very, very high. I'm black, number one, and I've got a father who had prostate cancers. So my risk is sky high. So I know I need to be checking my PSA every year. Equally, if you've had a brother who's had prostate cancer, then your risk is very high as well. So
that's the next question. You know, why is it that it's genetic?
So there is a genetic component to prostate cancer. We don't know fully why, and again, we don't know why black men are at increased risk. Again, it may be genetics, it may be other factors, but if you've got a family relative who's had prostate cancer, you're black. You've had first degree relatives, so your brothers, your dad who's had prostate cancer, your risk is very high, and you should be getting that blood test at least every year.
Okay, this is Unspoken, and this topic, it's unspoken. I know majority of us, you know, we come to the salon, we talk about football every time, we talk about, you know, women and things like that. That's another question. So follow this, you know, link, follow this Unspoken podcast, and we'll definitely give you referrals, you know, where you could do your blood test, GP, and the NHS. Doctor, okay, guys want to know, because like I said, what we talk about is football, sex, you know, things, alcohol and things like that, you know. What are the things that are kind of basic to the black people that can reduce or eradicate or increase the chances of having this?
Of prostate cancer? That's a good question. So there's a lot of factors, and some of them aren't very well understood. There is some studies, and the men may like this study, and quote it to your partners, that actually having more sex and ejaculation helps protect against prostate cancer. So this is the way you say, when doctors said we have to have sex.
That one you'll have it.
Everyone will go for that one, yeah. Also, things like inflammation or infection. So prostatitis, men that have a lot of infections at risk. We know diet, and this is a big thing, diet and lifestyle is really important. You know, I like my jollof rice, I like my carbohydrates.
Yeah.
But we know that diet is not good, and there's an increased risk of prostate cancer with certain diets. So I'll give you an example. In Japan, Japanese men are probably the fittest men in the world in terms of health and diet. Very fit, very low levels of cancer, and they live a lot, very long. Yeah. You take that Japanese man and you move him to the United States or move him to the United Kingdom, his risk of cancer becomes the same as everyone else. So it has to be more than just genetics. There has to be some environmental issue, either if it's the food or environment that's playing a part as well, basically. And with prostate cancer, it's the same. And we know that, you know, again, with black population, diabetes, high blood pressure, these are things that are killing our people. Yeah. And also it's increasing the risk of things like prostate cancer. So I think it's multifactorial. There's genetics that come into play. There's diet. There's poor diet. There's lack of exercise and lifestyle that all factor in towards why we're getting more and more prostate cancer and seeing it in younger men as well.
So we have to reduce our carbohydrate or
all the basic stuff, that the things that no one likes to hear.
Sugar,
you know, when we eat
like
sugar, tea, people take 3 or 4 cups of, you know, the simple things that you can prevent these long-term health issues, basically. You know, diabetes, hypertension, or high blood pressure, which can lead on to other problems, basically. Okay. People don't realize when you have rice, for example, big bowl of rice, jollof rice, it's carbohydrate. Your body burns that into sugar. Yeah. And that sugar is then overloaded in the system, can affect you. So even though we're not having sweets or things, it's an understanding that your body burns certain things into sugar, and then, you know, you wouldn't eat a big bowl of sugar, would you? But if we knew that big bowl of rice turned into sugar, you'd probably think more twice. Like, do I need that second portion? Adding salt to your diet as well can increase your blood pressure. So, you know, people adding a lot of salt to things. It's these little basic things that we do for over the years that can build up. Again, I'm not saying that because you do that, you're not going to have prostate cancer, because there's other factors at play. But these are things that we're not educated about, or if we are, we're not thinking about until it's too late.
There's a friend of mine, he basically, I think what he told me anyway, when he's having the number 2, it becomes difficult.
Yeah.
So is that part of it?
Well, that's
Or
a
not?
concern. So basically, it's not different to prostate cancer, but I can answer that question.
Because
normally you should be able to go to number 2, open your bowels, do a stool
Yeah.
once a day. Some people it's once a day, some people it's every other day.
Yeah.
But if you notice that you're changing your habits, so say you're going once a day, and all of a sudden you're going every 3 days, that's a change in your bowel habit. And that's a worry because that could signalize something like bowel cancer. So look at the late Chadwick Boseman, young black man, diagnosed with bowel cancer, and it spread and died. So we are seeing a lot more bowel cancer as well, especially eating processed foods. So if you notice there's any blood in your stool, or you're having a change in your habits, so what you normally do, if things change, then again, that's a warning sign, a potential. It doesn't mean you got cancer, but it's a potential problem. You should go and see your GP. There are good screening treatments, screening programs for this.
Okay.
But as men, we leave things till there's bleeding and your pain, then you go to your doctor.
Yeah.
And then it might be too late.
Yeah.
Whereas this symptom may happen a year ago, 6 months ago, but you ignored it. You're like, it's fine, I'll be okay, and left it.
Okay.
That's the problem.
All right. Doing my own research, but I thought, it's just 40, 50 guys that come with this, people that even I was watching on YouTube. But why is it that younger people are now coming with it the same?
Yeah, we don't know. I think it's probably the environment as well, especially for bowel cancer I can speak on. Processed foods, the type of food you are, what you eat, the type of food we eat basically. Whereas, somewhere where like healthier countries, maybe in Africa where it's more fresh food, grown in the village or in cities, but now we're eating convenience food, processed meats, fast food, microwave food. All that stuff over years is damaging our bowel, gut lining and can form cancers. The good example I give is in Australia. So Australia has very high rates of bowel cancer. Why? Because they're big people, big group of they like to barbecue. Yeah. Australians love to barbecue food, and barbecuing, you kind of get that burnt taste when you get the barbecued food. The problem is when you barbecue food, chicken for example, and you burn it, those carbons become damage the lining in your bowel and can increase the risk of cancer. So if you barbecue a lot, once a year is fine, but if you barbecue a lot, that barbecue food can damage the bowel and increase the risk of...
We like meat, we like suya.
Exactly. So that kind of stuff, in moderation is fine. I'm just saying, if you're doing it a lot and eating a lot, that can damage the lining of the bowel and can form bowel cancer. So these are things that, it's about education, People just don't understand, have never been explained. And unfortunately, people learn the hard way when it's already in you, it's spread. And we're seeing a lot more black people with getting bowel cancer, especially here in the UK as well. I was dealing with a case this week of a young lady in her 30s with bowel cancer. So, it's happened, but just knowledge is power, and a lot of us bury head in the sand. We don't understand, or we know it's wrong, but you're living your life, you're trying to make money for your family and work on your job. Yeah. And you don't realize that health is wealth. Yeah. COVID has shown us that.
Yeah.
Being the richest man in the hospital but having poor health is not going to help you, is it?
Yeah.
You want to have health. You trade health over money any time of the week. So it's really important to these things. But back onto your prostate issue, I do think getting tested is important. Having your PSA, and even when you have a raised PSA, knowing your values. So I always see men that come to see me and say, "Our doctor had a PSA last year. It's been done, but I don't know what the score value is."
Yeah.
Okay, I say, okay, let me ask you this: how much money is in your bank account? Don't tell me, but you know. Yeah, I know. So how can you know? You know what's in your bank account, but you can't tell me your blood test result. That shows where your priorities are. It's true.
That's
true.
That's deep.
You tell me, you can tell me to the penny how much is in your bank account. But if I said to you, you've had PSA blood tests because you're at risk of prostate cancer for the last 4 years, tell me your last value. I don't know.
That's deep.
What's your priority?
That's deep.
It's true. Like I see every week in, week out, guys that have blood tests. The GP is doing it, but they have no idea.
Yeah.
But I do see a racial aspect to it because I see most white men will come to me, our doctor, what's your PSA? Here's the printout. They've got a printout of their PSA for the last 10 years.
You have to get it.
Yeah, and
you have to get it.
Or they'll write it down, they know it. But a black man, they come, they're like, I don't know. Someone did a blood test, I don't know. It just shows the mindset. And again, it's not always black and white. It's not about black men and white. I'm just trying to give examples from my experience and the themes I've seen of the differences. So I said I had a gentleman, Nigerian gentleman. He was in his 50s. His PSA. So a normal PSA blood level, let me be clear, is normally between 0 and 4. It depends on your age.
Okay.
Yeah? So it depends on your age. But I'd say just use the value of between 0 and 4. If you're younger, between 0 and 3. But say between 0 and 4. So if your PSA is...
That's like...
is normal.
Yeah.
If
To
PSA
30 or 40.
Yeah. So if I be purist, if you're in your 40s, a PSA between 0 and 2.5 is normal. In your 50s, between 0 and 3.5. In your 60s, between 0 and 4.5. Yeah? So what that means is not just about one value, it depends on your age. The values are different. But anyway, let's to argument's sake, let's say between 0 and 4. So we had a gentleman who's 50, a Nigerian gentleman. PSA was 8, so it's double. Okay? There are 3 reasons why your PSA will be elevated. One is if you had infection. So say you had a bladder infection and burning and stinging when you urinate, and you do a PSA blood test, that will make the PSA high. So you can ignore the PSA. If you've got a very big prostate, so I told you that the prostate is normally the size of a walnut gland, but some men have the prostate the size of an orange. So 30 mils is normal size.
Okay, sorry, just to interject. But I can see, say for example, I see myself, but how
You
will
can't
that
see your prostate,
be?
yeah.
How would
It's
you
internally,
see?
you won't know. Some people walking around have a huge prostate, walking around have no idea because they've never had a scan.
But part of, that is part of your body.
Yeah, but it's internal. So the prostate is internal. You cannot see it. You can feel it, but I don't advocate you putting your finger in your bum to feel a prostate. That's just weird. Doctors do that. That's what we do to assess the size. But sometimes men will have an enlarged prostate, and the only reason they know is they have the symptoms. I said that before. Waking up 3-4 times a night to urinate, having a very poor flow, dribbling, being that guy that always takes long in the toilet. You know, we've all got that friend who goes and spends a long time trying to using your tummy to strain the urine out, getting blood in your urine. Can you imagine? There's people that have bleeding from the water pipe. Bleeding, they're so scared they don't see the doctor. They have the blood. Blood is not normal.
Yeah, because okay, say for example they've had sex before, they will just feel, oh okay, it's sexual.
Yeah,
whatever.
but you should never see blood. Blood is
just-
not normal.
Okay.
We also see guys who have blood in their semen after sex, and that could be a sign of prostate cancer as well. So if you ever see bleeding, it's not normal. But some guys are so scared they be passing blood, but they just don't see the doctor until things are at a point where they're in pain or they had to go to hospital or accident emergency. But back to my story. So I had a 50-year-old Nigerian gentleman. PSA was 8, so it's elevated. Yeah, it's high. Correct. I did the examination. I said, look, I think you've got prostate cancer. Please stay. The next test we do is a scan of your prostate called an MRI scan. I said, look, come and have the MRI scan next week. Then you need a biopsy of your prostate. The MRI is abnormal, and then we can move things from there. He said, oh no, Oga, I'm busy. I'm flying to Lagos. I've got businesses. I was like, look, there's no cost for NHS. Have your blood test. Have your scan. Deal with your prostate issue now. And then at least you know you go to Nigeria at peace. He refused. Anyway, he left. I never saw him again. He came back a year later.
A year,
because he went off and did other things. A year later, he came back via accident emergency. I was like, that name's familiar. His PSA was 60,000.
Whoa.
And he died within 3 months. And I felt guilty. I was like, should I have done more? I begged him to stay. There's no financial issue. It's not like we're saying pay for, it's free. But his priority was other things. And he died. And I always say, when I see men in front of me, I say, look, have the PSA, get checked, know your status, know what's going on. And then, in the UK, you don't pay for this. So you've got no excuse. I know in parts of Africa, there's a cost implication, or America, it's financially driven. NHS, we've got absolutely no excuse. It's all free. But again, people are fearful, scared, don't like hospitals, don't want to come to see their doctor, worried about whatever. And men are dying because of ignorance. Literally.
Another thing is, I was raised with, let's say, trado medical. Now, like you said, traveling in Nigeria and things like that. Okay. Once you have something like that, and maybe something is wrong, people call. Oh, can you get me this? Can you do this? And they will now send it, and then drink, whether it's root, whether it's whatever.
Yep, I know all about that.
Yeah. So should we kind of leave that, or still use it, or nothing, or just Because right now I'm just speechless
let
about it.
me ask you a
know.
question. Do you, in these traditional roots and drinks, do you know what is it? What's in it? Do you have any idea? A herbalist says drink this, you'll urinate better, or drink this, you'll get stronger erection, or drink this and your blood pressure will go. Do you know what's in there?
Yeah, usually we don't.
You don't know. So would you go if some guy offered you water to drink? He had a cup and said, "Here's water. Drink this." Would you drink it on the street here?
Yeah.
You didn't know this person. You don't know it from anywhere.
Well, yeah.
Yeah. So it's the same mindset. Why do you think that you would trust what's in this stuff? Look, I'm the first person to say I don't understand all herbal medicine. There are some things that are beneficial. Look, drugs came from herbs. So I'm not one to say, herbs is bad.
Yeah.
But when you've got a proven treatment and people are running away from conventional treatment to go and seek herbs, that's when I have a problem. I'm not saying, look, go and take the herbs, but at least know what's going on, basically. Yeah. Like I see guys who have got prostate. Some men have been diagnosed with prostate cancer, and they need surgery to remove the prostate or radiotherapy, but they refuse. They would say, look, I don't want this. I want to bring my PSA down myself. I know one traditional guy in Nigeria. I'm going to go and see him first. And I've seen guys go off to Nigeria, come back, their PSA's tripled. And they've missed the window to get treated because they've decided to go and seek alternative treatments, which haven't worked, and they've come back now trying to get treated, and it's a bit too late. So again, I sound frustrated because I see the same story each time coming, and people are literally dying because of ignorance.
Wow.
I don't have all the answers, and modern medicine doesn't have the answers, but at least know what's going on. Knowledge is power. Yeah. If I said to you, look, your PSA is 8, you've had a scan and your biopsy shows you've got cancer, your treatment is surgery or radiotherapy, or we can watch it. But you have all the knowledge, but you choose to go to Nigeria. That's fine. I've given you the information. You're fully empowered. You're an adult. You've got your full sound mind. You've chosen to go and do that. That's on you. And I've warned you that if you do that, there's a risk of it spreading and death. And you do that, you're an adult. That's you. But where you don't even want to even have the test, you don't even want to do any of the things, and that's a problem.
So, what is the best way or treatment to deal with it?
It depends. So with prostate cancer, it depends. You have to have the blood test. You have to have the examination. It does involve putting a finger in your back passage. And yes, some people in our community, they think it's gay. You shouldn't do that. But we're doctors. I've done thousands of these examinations. It's not a big deal. Most men are very anxious when they come in. But by the end of it, they're laughing. Oh, it wasn't that bad. Okay, fine, move on. So we get over that initial issue. If the PSA is high, the examination is abnormal, you have a scan called an MRI scan to scan the prostate. And then if the MRI scan is abnormal, you'll be offered to have biopsies, which is putting a needle into the skin and taking samples of the prostate. And it's a bit sore, but we put anesthetic, it's numb, and then we get the result.
From the groin or
from the prostate, so from the rectum. Okay. So either the rectum, but we don't do that anymore, through the skin, above the rectum. So the space between your rectum and the testicles is called the perineum, and we take the prostate sits behind that, so we put a needle into that. We numb the skin and numb the area, and then put a needle into that area to take tissue from the prostate gland.
That's the one people will be scared.
Yeah, they'll be scared about it. But we do 10 of these a week in King's in our hospital, and I've not had a man screaming like they're anxious, but by the end they go, "Oh, it wasn't that bad, doctor." I was like, "Yeah, of course. Your fear was more the worry about doing the test. Okay. Once it's done, it's not a big deal." And there are men who just say, "Look, I can't do that," and have a general anesthetic, which is fine. It can be done. And then you get your result. So you get your result, and then it depends on how aggressive the cancer is. Some cancers are very mild, and I say, look, this is cancer. It's not going to kill you. We're just going to watch it. We do a PSA blood test every 3 months. We do a scan every year, and it's called surveillance. We just watch it. And if it changes, we treat. If it doesn't change, we just keep watching. Because sometimes there's more side effects of treatment than there is just leaving it be. Yeah. Some people have more intermediate or aggressive cancer and say, we can't watch this. If we watch it, you'll be dead in 6 months. They need treatment. If it's not spread, then we can do surgery to remove the prostate, keyhole surgery with robot, or give X-ray radiotherapy treatment to treat the cancer with injections. And some men, where it spreads, they may need chemotherapy or other things, basically. So there are a lot of treatments available for prostate cancer if picked up early. If picked up late, this is not going to cure you. This is just to prolong your life. And there's good drugs. I've seen a guy who had prostate cancer that spread, survived 10, 15 years, which is good. But some people, they succumb within a few months. But the take-home message is if it's picked up early, it can be cured.
Yeah, because that's what I want to bring. Okay, if it is a blood test that will give the initial thing, why not do the blood test before it gets to...
Correct.
Yeah.
Exactly. Have a blood test. I know some men don't want the examination, but I work with people. Do the blood test.
Yeah.
And then take it from there. If the PSA is very high, so say I told you between 0 and 4 roughly.
Yeah.
Your PSA was...
If it is mild, so what do you subscribe in terms of eating habits or food?
It's just more
medicine,
more of a
vitamins.
Yeah, it's more of a healthy
like
diet, taking your vitamins, exercise, what you eat basically. But if you've got, and don't forget, some men with waterworks symptoms such as poor flow or waking up at night when they urinate, they don't always have prostate cancer. It just may be the prostate's enlarged, but it's not cancerous. And some men have the symptoms and have cancer as well. So it's my job to discern which men have symptoms due to cancer or symptoms just due to, a big prostate. Because as a man, when we get older, our prostate's going to get big and we're all going to have this problem, especially black men, our prostates are bigger. So these symptoms will come to us at some point. It's just whether it's cancer or non-cancer is the key.
Okay. And, okay. Another thing is, all right, people are believing that, okay, it will be cured. Mm-hmm. It will be healed. Miracle. What do you
mean
think?
you cured as in religiously, like God will cure me or?
Yeah.
We do a lot of.
I've been like the hospital one time where there was a guy that was, I think maybe it was prostate, and he was telling the doctors that no, I'm just gonna be drinking water. I'm gonna be drinking water. Yes, and my body will heal me and things like that.
Look, we don't have all the answers. I'm not God. I can't predict everything. But based on the thousands of patients we see, we know what's going to happen. So those kind of patients, I say, look, I explain very clearly. You don't want to get treated, fine. This is what's going to happen. It may not be tomorrow. It may not be 3 months. But at some point, your flow is going to get very bad. You may become blocked where you cannot urinate at all. You go to A&E, they have to emergency room, they have to insert a catheter. So we know how these things progress. And look, I'm Christian as well. I do think that God can heal everything and most things, but I think let's be sensible. Let's at least understand what's going on, so then you can help yourself, basically.
Yeah.
Knowledge is power. Accept the medication, accept the lifestyle and that advice that your doctor's giving you to live a healthy life in combination with what God can do as well, basically. But I see it a lot all the time, guys thinking that, okay, well, I'm not going to accept the treatment. I'm going to go off. I'm going to do whatever I'm doing, be that praying only or religious or herbal things. They always come back. 6 months later, they got a big problem. And actually, then it's worse because they've left it.
Yeah. All right. Wow. Guys, well, right now, I'm just like speechless.
If you don't mind asking, how old are you? Are you in your 40s now? Are you
Yeah.
Have you had a blood test, PSA?
I had maybe last year or year before.
Do you know you don't have to tell me your PSA,
I don't,
but do you know it?
No.
Why?
What I did was I was having a blood test, and I think the nurse it was me.
Yeah.
It was me. Yeah. When my uncle died.
Yeah.
Then I called hospital,
PSA.
like, I want to do this, but because I usually go, so it's like, okay, yeah, we'll include it. So they included.
But do you know the value? Did they tell you the value?
No.
That
was it.
This is the problem. This is a big problem. People, and even when you do the blood test, we're not empowered enough to get the result. People just think that, okay, the doctor didn't call me.
Yeah.
It must be normal.
Yeah.
That's flawed thinking, because I work in NHS. I've seen a recent situation where I don't want to say too much information because I don't want to give away the problem, but imagine a scenario where you have a blood test and you never had a result and you assume falsely that and no one calling means the test is normal.
Yeah.
Bad. This gentleman had a very high blood test, assumed the blood test was normal, didn't see anything. Fast forward 10 years now, the PSA's 20,000. And then you go back and say, well, how can this be? I had a blood test. We can see the blood test was abnormal, but nobody told me. Why? Because why didn't you go and speak to the GP? Oh, well, I thought no one called me, so it was normal. That's dangerous thinking.
Right.
Again, I use the bank analogy, but if I transferred you £1 million in your account, and I just sent it to you. You check your account, just make sure the £1 million is there, right? You wouldn't go, oh, I think it got there.
Yeah.
But that's the mindset you would. So while you're not doing that with your blood test results, why don't you find the result? If they don't send it to you within a month, you call, excuse me, doctor, can I have the report, please, that showed my PSA blood test? The system's not imperfect. We see hundreds of thousands. GPs are so busy right now. Not saying they don't care about you, but their time is stretched. Things slip through the system. Oh, you're your best advocate. Only you will advocate for yourself properly, not your GP, not your pastor, not your wife, you. So, but you see that point, £1 million, you check. You go and check your account, make sure the million's wired. I will. Be good. But why are you not checking your PSA value after they've sent you the video, assuming it's normal? You can't do that.
Wow. That's my first...
I use money because it hits people. People get the money and
that's value. That value.
It makes sense. Money.
Yeah. That's my first agenda this week.
Get the result.
Thank you, Dr. John. In wrapping up, what do you want to say to our audience, unspoken and unspoken people?
Well, I want to appeal to the men directly.
Okay.
If you're all men, let's not make race, but men, black men, above 40. Go and see your GP. You may have never seen your doctor. Some men are proud. I've never seen my doctor in 40 years.
A lot.
They're proud of that. But the problem is you don't know what's harboring within you. And I'm not here to be doom and gloom and say things are going to be bad, but at least get your result. Knowledge is power. Health is wealth. Go and see your GP and get that PSA blood test. Do not let them. They're like, oh, you're young. You've never seen us. Demand that PSA. You cannot. They can't turn you down. And then have every other year, get checked out. It's better to know if there's a problem and deal with it early than leave things, basically. That's number one. Number two, for those that have had PSA blood test and don't know the values, get all the reports. Make sure you know your values.
So you have to physically get it.
Yeah, or call them and get the report, or ask them to send it, or when they send a letter, send the report to you. Get into that habit, because you need to be in power and control of your results and what's happening. Don't be a bystander. Be an active driver in your health, because that's the only way things get done. Yeah. And to the women as well that are watching, maybe your partner's saying, I'm fine.
Yeah.
Keep nagging. Like, a lot of women literally saved their partner's life. If it wasn't my wife telling me to get a blood test, I would not be here. If it wasn't my wife saying, oh, that blood that happened, go and see your GP, I wouldn't be here. So our wives, our partners are really doing a good service, and they need to continue, because women understand the benefit of screening. Yeah. There's a problem, and get checked to make sure there's no problem. But men, we're so far behind, basically. And that mindset needs to change. And it is changing slowly, but it needs to change a lot more. And in the UK here, there's no financial barrier. I've worked in the United States. I do some work in Nigeria, where literally that PSA blood test is either you pay for that blood test, so you're not eating for a week or a month. And they can't afford that. In the UK, we've got absolutely no excuse. We can go to our GP practice. There's no payment. There's no charge. If I tell you that I see a lot of men from Nigeria in the UK for second opinion treatments, and men that have been diagnosed with prostate cancer. If I tell you that radiotherapy costs £80,000 for a course of radiotherapy that we in the UK get for free, we don't even think about it. Those guys will do anything to be in the same position, have access to healthcare, and we're wasting it by not doing anything with it.
Doctor, my podcast, this one is a speechless kind of podcast. I'm just like literally shocked.
Yeah, I'm sorry. I don't want to sound aggressive. It's pure frustration.
Because you see it every day. And that's why I kind of, when my friend Derek was, like, oh yeah, I'm like, oh, really? Is he gonna agree? But this is so much. I mean, literally
if
now
I can touch one person. If one person contacts
right
their
now,
GP,
a lot of people now, it's gonna be affected. Like literally right now, because even right now, I'm just gonna be like a person to spread it now. Right now,
And actually,
advocating
you're
for
you're probably in the biggest position to do a lot of health work. So, so we know black people have poorer health outcomes compared to white when it comes to prostate cancer and COVID, and we've seen studies in America. But there's been some big studies looking at places that black people go, not necessarily in the traditional settings, such as churches, or barbershops. There's a study where they looked at black men with blood pressure, and black men have very high blood pressure, poor outcomes. But they empower the barbers and the people working in barbershops to talk to men about blood pressure and health. And actually, those men, and they did a study where they looked at different barbershops in a city. Half of them were told get educated about blood pressure and prostate and screening, and when men are talking here about football and sports, how's your PSA, how's your health, and encourage them to take their blood pressure tablets. And the other half, there was nothing normal. The men that had the intervention, the barbers being trained, not necessarily being trained, but talked about things.
Yeah, talk about
all
it.
of them compliant. The compliance was a lot better. They were healthier. They were better. Yeah. So it shows that in reaching out to black men, maybe we have to do it in places that aren't traditional. So maybe black men aren't in GP practices. So go to barbershops, go to churches, go to sport clubs, and get these conversations going, because it's a safe space and more comfortable space. So barbershops are really important. And I do work with research in prostate cancer. And black people, our numbers in research is very poor. Almost non-existent. Yeah, even though it's affecting us the most, we're not imparting studies. All the studies are with Caucasian men. And I had a meeting the other day and they're like, why do you think black people aren't? I said, well, A, it's fear, vaccine and fear about research. Yeah. The second thing is we're not talking about it. We're not, how we get into, the studies aren't getting to the right people. They're going to practices, but the black people aren't there. Maybe come to barbershops, maybe come to people like you and say, we're doing a study on prostate cancer. We need to get 50 men. You see black men all the time. Maybe this is the connection, and we're not thinking we need to start thinking outside the box. Otherwise, it's going to be the same problems over and over again. So you can help as well.
Thank you. Well, definitely from now. From now. I mean, I'm an advocate right now.